This is OMS Voices, an Amos podcast. I'm Bill Klaproth, and with me is Dr. Michael Shnayder, who is here to discuss dental implants, long-term solution to missing teeth. Dr. Shnayder, thank you so much for being here.
Absolutely. Excited to do the podcast,
Yeah. So first off, what is a dental implant?
So dental implant, really it's a titanium structure that replaces a person's tooth. And really it's a single implant could replace a single tooth, whereas two implants can replace multiple teeth. And if needed, you can actually place implants so that they support a denture, kind of replacing somebody's, their whole upper and lower function, restoring that.
So why would someone choose dental implants?
In 2022, it's the best solution. I mean, really, until we can figure out, and I think they're working on it, how to grow teeth and control that.
Right.
It's really the gold standard.
So when you talk about dental implants being a solution, is this a solution for everyone or just certain people?
It really is a solution for everyone, short of somebody being a little bit too young. So if you're still growing, you wouldn't be able to place an implant in somebody who's still in the growth stages. But really after that, even in patients who are, to a certain degree, there's probably certain medical conditions which would prevent them from having an implant or wouldn't be recommended. But otherwise, even smokers and somebody who's a diabetic, there's other medical conditions that we can work around or do some modifications where we can still place implants.
Right. And dental implants certainly have benefits above and beyond, dentures, which we all know of and have heard about for years. And our grandparents, we've seen our grandparents with dentures. Is that right?
Absolutely. I mean, it's really the technology, everything has changed over the last even 5 to 10 years dramatically, where everything has advanced to the point where those patients don't have to suffer the dentures and falling out dentures, inability to chew, inability to speak, being worried about them falling out. It's amazing what we can do. We can just replace them where it just changes everything. Yeah, where we can place 4 or more implants, usually it just depends on a case, and stabilize that denture and pretty much give them almost 100% function back.
Yeah, which is amazing. So oral health is so important. So what is the general success rate of dental implants then?
General success rate, and there's multiple companies, and each one has its benefits, and they're used by all the oral surgeons everywhere. But general success rate tends to be over 95%, which is incredible.
Yeah, that is truly incredible. So someone who chooses dental implants can think then these implants are going to last.
As long as they're properly cared for, you still have to go to the dentist. You still have to do, your checkups and everything like that, depending on what kind of a prosthesis we're doing. If it's a single tooth or if it's a denture that's being supported by implants, there's variations. And that's where your oral surgeon is going to be important because they can guide you through that whole process. But yeah, they can last a lifetime.
Well, that's a good point. So let's talk about that. Why choose an OMS to place dental implants?
I think oral surgeons, as an oral surgeon, there's many different specialties and everything like that. But really, we go through additional training. We go through rigorous training in our programs where we place the implants. We learn the bone biology. We learn the technology behind the implants, why choose one versus the other. And then we, through rigorous training and really hundreds of implants that we place during our training, we'll learn the intricacies behind that. So it's very different from maybe even a local dentist who goes to a few courses and then, starts placing them. Are they qualified or will they be qualified maybe in 10 years, once they get to a certain number of implants that they've placed and have experienced complications and, some other things?
Sure. Yeah, this is a complex process. You mentioned bone before. There's also soft tissue and nerves involved, right? So you got to be careful. You really want an expert
Correct.
Doing this because of the challenges that you're faced when doing this.
Yeah, 100%. Nerves is, one issue. In the upper jaw, we get close to the sinuses, so that could be another problem. And really, you have to be comfortable. There's techniques that, as an oral surgeon, through the surgical training, that we'll learn how to avoid those or how to do something to rectify some of those issues in anatomy things.
So when it comes to dental implants, what's one of the biggest questions you get about them?
I think the biggest question we get, and it's really more of a life-changing experience for people who are wearing dentures. And I think for them, they're like, well, am I going to be able to chew? And for a lot of them who've worn a denture, if you're out there who's worn a denture, everybody knows, especially not being able to taste. And people who wear dentures start losing their ability to taste because the palate is covered, and they don't get that. So I think the biggest thing sometimes people get is they're like, am I going to be able to do that again? And yes, really with implants, once we place implants, they can support the denture. We can get rid of the palate. They kind of get their function back. They get their speech back, everything.
Well, this has been fascinating and very educational. So anything you want to add when it comes to dental implants, long-term solution to missing teeth?
No, I'm just kind of excited about all the technology that's coming out. Implants continue to evolve, which is great, from different surfaces, different designs that we're seeing right now. Stability, success rates actually keep going up. We talked about success rates earlier, but yeah, they actually keep improving, keep going up. We're just getting better and better. So I'm super excited to be kind of practicing during this time.
Yeah, really fascinating. So not only can you help someone with their oral health, which is so important, having a good set of teeth to be able to chew, but you can give them a new smile, which can add that confidence when going out in the public too. Is that correct?
100%. Yeah. I think a lot of these people, and especially with social media now, people see this all the time, but it's life-changing for these people. Yeah. It gives them their confidence back. Yeah.
Well, Dr. Shnayder, this has been fascinating. Thank you so much for your time.
Thanks, Bill. Thanks.
Absolutely. Once again, that is Dr. Michael Shnayder. And for more information and the full podcast library, please visit myoms.org. And if you found this podcast helpful, please share it on your social media and don't forget to subscribe. Thanks for listening.